Here at Vibe Science, ultimately, we're here to empower you to your best self. It's about mind, body, and energy. And you know what? When you work out a lot, when you're eating a healthy diet, it's hard to get enough sodium. It is one of the most important factors in hydration, and hydration controls so many variables of how we feel, how our brain thinks. That's why we're proud to partner with Warrior Salt. Hey, we like to take the BS out of stuff. This is no bullshit, just electrolytes, straight fruit powder and salt, the real deal. I love this product because it's simple. Sometimes we get overcomplicated in the supplements we take, but all I know and what I've learned and the science has proven is you have to have enough salt for that balance of hydration. This stuff mixes really easy with water, as you see. You got to be watching the YouTube to get the full effect of this. How easy that mixes in, and a very simple citrus flavor that's delicious, easy to drink, and perfect before and after the exercise to stay hydrated. Look, if you're already thirsty, you've waited too long. That's why you need Warrior Salt, official partner of Vibe Science and Ryan Alford. Delicious, and will keep you hydrated all day long.
So a root canal, you have that tooth, it's alive. So you have pain because you have a huge cavity and basically the oral bacteria jump in there. And then the immune system in your tooth, in the pulp, cause an inflammation, pain. Then we take out that vital, alive part of the tooth called the pulp. We just take it out and clean it and disinfect it and fill it. But basically what we leave in your body is now a dead shell of a tooth. Chronic infection, meaning chronic inflammation. And in the epidemic of chronic health issues, we need to find all these silent inflammations because they are firing up the system on a low grade. That's the root canal thing. So I have seen a ton of guests here in my hometown from all over the world that had veneers, but the complete tooth structure was destroyed. So they ended up having a lot of root canals, a lot of dead teeth, just to have a nice aesthetic. That's the wrong path. This is actually something we learn as dentists in university is as soon as you use that drill, you're going down the rabbit hole into the dental career, which means more cavities, more tooth decay, bigger restorations, root canals, titanium implants, all this restorative stuff.
This is Vibe Science, a top 100 wellness podcast presented by the Radcast Network, breaking wellness barriers and making health truly personal. Here are your hosts, Ryan Alford and Chris Hansen.
Hello, and welcome to Vibe Science. We're always here to take you to your highest vibe. It's about mind, body, energy, as we empower you to take control of your overall health and wellness. Hey, we're the guides. We don't know it all. But what we do is we bring the specialists that teach you everything. Chris and I are here on the journey. Chris Hansen is always in Miami, my business partner, good friend. Chris, good to see you today, man.
What's up, Ryan? How are you today?
I'm great. I'm excited. I'm ready to get the vibes high. And, you know, we had a good talk pre-episode talking about some of the, and what I love about this show is we sort of remove like the stigma and also like the veil, like uncovering these things that aren't talked about enough, but how important they are and how much like growth and innovation that's happening within some of these industries. And hey, no better than going to the source himself, Dr. Dom. Dr. Dom, what's up?
What's up, guys? Happy to be here.
Yeah. Dominik Nischwitz. Dr. Dominik, I like Dr. Dom. You know, that's cool.
It flows easy. Yeah.
It flows easy. And I'm like, I already like this guy, Dr. Dom. He's figured it out.
Yeah. Nice guys.
Where's home, doctor?
I'm in Germany, actually, south of Germany, Stuttgart area.
Yeah. Is that original home, like born and raised? Or
yeah.
like...
Funny enough, I'm actually born and raised here. I've been all over the world for training and everything, but never made it far away from my home base.
Yeah. Dr. Dom is a pioneer in biological dentistry, and he is the founder of DNA Aesthetics. Dr. Dom, I got to admit, I didn't wrap my head when I first read biological dentistry. I'm like, what does that mean? And then, I kind of like guessed, and I read more about all what you're doing. I'm like, you know what? It's funny when we have, amazing guests on the show that are doing innovative things, but then it's like, especially when they just make sense. It starts to make sense. I mean, so much starts in the mouth, right? It's like, it's the center point where, where we eat, where we talk, where we do things, we breathe. And yet it seems to sort of get forgotten about on some level. Why is that?
Yeah. I mean, the mouth is the entrance to the body. It's the first contact we have to the outside. And, little babies stuff everything in their mouths to get their immune system going. However, dentistry or conventional dentistry, the way we're all taught as dentists, we have to go through school and study this for a couple of years. This is a mechanical thing. It's more about repairing your teeth for biting and maybe for smiles, cosmetics, and maybe get you out of pain. But there is no connection between the technical side of things and the overall body. It's just a separate unit. Such as there's a heart doctor, there's a doctor for your intestines, there's a doctor for your hormones. It's the same as a doctor for your teeth, basically. In Germany, a dentist is actually called tooth doctor. However, conventionally, we don't behave like doctors. We literally behave like mechanics. And I mean, this is what we need to change. And my mission for the last 15 years is that optimal health starts in the mouth. Was my personal mission, obviously, which slowly graduated into a complete transformation of our profession into a whole movement to, change our profession from the technician to the overall health expert. And that's what I refer to as biodentistry 3.0, not just biological dentistry. Because we touched on that before. Biological dentistry, even if you say, it makes a little bit of sense. But if I tell you to go see a biological dentist, it means nothing. There is no trademark. There is no standard. It's just like, go see a real estate agent, go see a personal trainer. So how can you distinguish? And therefore I made it the extended movement to create a biodentistry global standard, BGS, that I'm working on, that literally combines our high-tech craftsmanship that we still need, but we combine it with functional medicine, health optimization, biohacking, like every cutting edge science that you can imagine can also be applied to the mouth. But we just start your health journey in the mouth. And this is like, for most dentists, this is complete woo-woo game still, and not even taught a tiny bit in universities. It's literally a complete transformation, literally from the garage to an overall health expert. And I think that's what I'm most passionate about.
Very, very different way to think about it. Not how the way it's thought of, here in the States. I don't know that it is universally anywhere. I think part of me, when I was hearing you talk, I was like, I think part of the challenge has been, there's been the proliferation of like the aesthetic part, right? We all want to look good. We're all vain. We want shiny white teeth. We want them straight. We want veneers. We want all that. That's great.
Yeah.
But the biological side and impact of the mouth, I think, has kind of taken a back seat while the aesthetic has come forward. And that's, you need both. I mean, you want, one's a want and one's a need, right?
Yeah. Yeah, exactly.
I wanted to talk about the veneers for a second, because that's on every corner I walk by. There's an advertisement for veneers down in Miami. Yeah. And I have a lot of friends that have got veneers in their 20s. And I feel like now the conversation is kind of starting like, hey, there's long-term consequences to some of these lower quality veneers, you could say, right? Can you touch on that at all, just with veneers and the health impacts?
Definitely. I started as a cosmetic dentist myself, and also am an oral surgeon. However, so I get the vanity thing. Everyone needs to look good. And I think it is inherently an expression of ourselves, like that we want to be our best. And obviously the teeth are in the middle of your face. I personally don't have any veneers, but I understand that this is central. However, veneers are not always veneers. So this is where I think it's important to understand. So dentistry, for now, even the highest biological dentistry standard I'm training, is we have to have our skills down as technicians. We need to be excellent in everything. And if you then, from a biological point of view, do veneers, this is a backward planning system. So it starts with your biting structure. It starts with a face scan. It starts with a complete digital planning, backward planning, so that we know, okay, we need to shave a little bit of the gum here. We need to add a little bit here to make it perfect. But in essence, a veneer is an additional work, which is like, a veneer is as tiny as your fingernail or as thin as your fingernail. That's a true veneer. And there are not many people out there that do this. A lot of times veneers if you go like turkey teeth or market it the way it is, oftentimes you end up having crown work. And crown work means your whole teeth is shaved down. They're sold as veneers, but that's crowns, and this is destroying your teeth. So a real precise, perfect veneer is not destroying your teeth at all. It's additional work. It's basically an adhesive treatment. But how, again, can you know as a patient or as a guest on your journey, what are you buying into? So I have seen a ton of guests here in my hometown from all over the world that had veneers, but the complete the complete tooth structure was destroyed. So they ended up having a lot of root canals, a lot of dead teeth, just to have a nice aesthetic. That's the wrong path. Definitely. So basically, a lot of times the dentist is the root cause in the first place. So this is actually something we learn as dentists in university is as soon as you use that drill, you're going down the rabbit hole into the dental career, which means more cavities, more tooth decay, bigger restorations, root canals, titanium implants, all this restorative stuff. And what we have to do now, so my place in Germany, the blueprint clinic for all this, is more like a highly specialized referral center for optimal health, like a destiny place where most patients or guests, we call them, fly in from all over the world because they had so much previous dental work done and they want to have it finally fixed in a more biological way once and for all. So we basically modernize the complete house, so to speak, or remodel everything once in a lifetime. It's 2 stages. And our goal is obviously to never see you again as a dental patient because you learn so much on that journey about overall health optimization. And obviously we build you the perfect teeth, only ceramics, even the implants are ceramic, so that you literally don't have to come back versus conventional dentistry is kind of like a repeat business structure. You definitely come back with a new tooth decay. If you need another crown, you maybe need another root canal. So you see, it's a complete change in our profession. So this is what I also need to bring across. So biological dentistry wouldn't mean that this is high-tech excellence. Veneers doesn't mean it's high-tech excellence. Nothing is trademark or standard. Basically, everyone in dentistry or in medicine can call themselves whatever over the weekend course. And this is what needs to change. So we really need to have an ISO certification standard behind it so that we know all these protocols work the same way on the foundation of being super technicians. So right now we do a lot of revision from past dentistry because that is still a huge trigger for all that epidemic, which is chronic disease.
Yeah. And I think you nailed it. I mean, whether it's global, but a standard, right?
I think the dentist is always trying to do the best they can with their level of awareness. I think the system is completely broken and completely just outdated. I mean, we do stuff in the mouth that was outdated 50 years ago, using materials that are just old school that no one needs anymore, like a metal in your mouth. Come on, guys. So this would be like, we use a metal in your mouth that started in the 70s. It looks the same 2025, an implant, a dental implant. If you had lost a tooth, you need an implant. 99.8% of all dentists worldwide do a titanium implant. I'm a ceramic implant specialist for over a decade, which was ridiculed or belittled over years. Now is guideline. However, I'm just talking about updates. Like how did your iPhone or your cell phone look in the 70s? It wasn't existing. So why would you not change something? And why would you expect actually that repair lasts a lifetime? I try to obviously optimize this once and for all for our guests so that we don't need to see them again because they learn then about nutrition, learn about overall body health. They have the perfect function and aesthetics and everything is set up in a more architectural way, backward planning and everything. If veneers are needed, of course we do veneers because they are also functional. But this is a complete rethink. It's a complete reframe of everything. And yeah, like I said, it's just outdated. And this is why all my teachings for the Biodentistry Global Standard are just first and foremost a software update. So an iPhone 5, iOS 5 doesn't communicate with an iPhone 16. So there is a lot of knowledge gaps in between conventional, traditional dentistry, which is technical focused, versus what we teach, biodentistry, the complete health matrix of the body, including obviously highest level of progressive dentistry, which is ceramic implants, which is membranes made out of your own blood, which is using IVs in your clinic, hyperbaric, all these things. That's usually not seen in any sort of most medical clinics, but definitely not in quote unquote dental clinics. But we are always saying we're not dentists. We are the future of it, from the technician to the health expert. And I think this is how we transform and change. And I think most of the colleagues, if you're a little bit open-minded, they resonate with it. Especially, I think Chris and me, we already talked about, especially the younger generation. Let's say millennials like me or younger. I have people writing me on socials that are studying right now. They're saying, we read your book. I'm 25 years old. I'm just waiting to go through university, then do what you teach us. I know it's just the entrance card. But obviously, Chris said it before, I understand a lot of dentists went through school having $500,000 in debt, and they think they already got it. But if you get humble again and see it's just the entrance card, and it's about overall body health and your nice technical work, then it becomes a new thing. And then it actually makes sense to help people heal on a whole body system.
Dr. Dom, what are the eye-opening things that we overlook that are related to sort of oral health and overall body? Like, I know you're enlightening a lot of people with the biological side, but what are those things that people kind of go, whoa, I had no idea.
Yeah.
So
basically what I'm always teaching is I ask the audience 3 questions, even you guys. Question number 1, is there any metal in your mouth? Stand up and remain standing. I did that on the Health Optimization Summit 2 weeks ago in Austin, which is only our tribe, people that are already on that journey. The second question is, any root canals in your mouth? Stand up. And the third question is usually, you have a root canal?
2.
Oh, man. So we can touch on this one. And the third question was, have you had your wisdom teeth pulled? I know, Ryan, you didn't. You have your wisdom teeth, which is amazing, but Chris had them pulled. So now the complete audience will stand up. And this is what I bring to the table is, in that game of health and optimal health, we're all getting kind of dogmatic even with tracking devices and being super strict with nutrition, which is fine. So we should do the whole food diet and going out in sunlight, having the circadian rhythm dialed in, sleep tracking, sleeping mattresses, sunlight, you know what I mean, grounding, supplements, IVs. However, if you do all these things, which most people do on these conferences, biohacking conference, but you're still having nagging issues, or you're not superhuman, or you still have low deep sleep, or you can't sleep, whatever, then it is time to look further. And maybe there's something in your mouth lurking there, a chronic silent inflammation or a toxin that you don't even think about, because your dentist definitely didn't tell you, because it's not conventional wisdom. So that's why I asked you 3 questions. So if you had an answer, a yes to any of this, I know there's room for optimization. And luckily, oral, the mouth and oral health is getting a bit more into the health game. So I think last year, Huberman spoke about it, Peter Attia, bigger podcasts, but they're only touching the surface so far. They're speaking about the toothpaste. There might be chemical not ideal, but more the oral hygiene strategies. Let's say bleeding gums, tooth decay. That's basically it. But what about previous dental repair? What about these metals in your mouth? Or your root canals? You didn't even think about it, but if there's one thing that is most unnatural to the human body, it's dental repair. It's not the way how you came out of your mom, right? There was no root canal, no metal. So that's been done by a dentist for you in their best interest. However, this is something you cannot biohack yourself. This is something where you need to see someone specialize in this. And this is not really existing. You see the dilemma here? So the WHO says 70% of all chronic disease starts in the mouth. And actually, tooth decay is #1 chronic disease worldwide. So you see why it's so important to have someone look from a more overall body perspective at your panoramic x-ray and see, oh, we see metals. They could be a problem. Root canals, like you have, Ryan, and what you have, Chris, most likely cavitations, which is chronic silent inflammation in your jawbone, stemming from previous removed wisdom teeth. Like you told me, you were 16 years old. You had medications from your doctor, but you definitely were not on the right nutrition diet. You were not anabolic enough. You were growing up. You probably smoked. You probably drink. I don't want to say that. I did that. So
I did. I was doing all that.
Me too. I was smoking. I drank a lot of alcohol. I partied a lot. So definitely my body wasn't healing. And that's the problem. Yeah. You're not, the dentist gives you this best information. Hey, we need to take out a wisdom tooth. Probably correct, because there were no space for them. However, they didn't prepare you. You just went into surgery, had massive swollen cheeks, were not prepared. You took your ibuprofen and the pain meds and the antibiotics, and that's it. But what happens over time is that these areas in your jawbone, they don't heal. and they become chronic silent jawbone inflammation, called cavitations in layman's term. And this is something medically known as FDOJ, fatty degenerative osteonecrotic jawbone. However, this is something you don't even learn in dental school. It's not existing in the curriculum yet. We're working on this. However, if you now go to see a biological dentist or any dentist and do a 3-dimensional x-ray, they won't even look for it because they just don't know. So you see the dilemma. There might be a huge inflammation chronically in your jawbone, causing all sorts of cytokines and sympathetic stress and hormonal disruption and gut issues. No one will find it because no one knows about it.
That's scary. And that's what
wild.
you just
The
went
gut
where I
too
wanted.
is wild.
I didn't want to scare you guys. I'm just here to bring information.
No, but it's like
Educating.
not even looking for it, and is the scary part. And you kind of hit it at the end, Doc. I was like, how do these things manifest? You know, like I know when I got a toothache, I know when I have a headache that's kind of related.
Yeah.
But it does manifest in other symptoms that might be stemming from the mouth and you not even know it.
Right.
You know, like you said, gut or whatever, but probably what are those other symptoms that can
like
be?
literally it could, if you're trying everything and it's not going away. So you have a frozen shoulder, you go to your physiotherapist for like a decade and it doesn't go away, or you have like a knee problem chronically. It might be that root canal sticking in the jawbone causing activation of the sympathetic. And then you have to understand that that all your teeth are an extension of your brain and they're sitting on a cranial nerve called trigeminus. This goes directly back into your brain and is connected to your hypothalamus, to your stress axis. All of you know stress axis, pituitary, hypothalamus, pituitary, adrenal gland axis, and can cause chronic stress. So the usual suspects are chronic fatigue, skin issues, because of the gut-related things, gut issues, irritable bowel syndrome, frozen shoulders, structural problems in your body, especially important for athletes, and that are like need to be more fine-tuned. But basically, a mental load is, let's say, anxiety, even depression. Like there's everything. But the thing is, you cannot say this is the main cause of it. That's why I said, if you're already trying to optimize everything, but you're still not 100%, then it's time to look there. And in my opinion, it should be very early in your journey to optimal health. Should be someone diagnosing your oral system for previous dental repair, because it makes no sense to detox your body or do any cleanses or everything if the main source of toxicity is still in your mouth. Then the juice cleanse won't do the trick. Or you also shouldn't do any chelations, for example, like heavy metals things, if you have a heavy metal filling in your mouth. So we have to remove the source first before we do crazy things. However, most of us are not trained to remove the source first, and we're just trained to put the source in. So you understand where this is all really in. Really, the mouth is an extension of your brain. It's not like if we work on your teeth, it's kind of like, or if I do a surgery in your jawbone, it's kind of like a surgery in your skull. It's a surgery in your head. It's a surgery in your brain nerve. So this is how extreme this literally is, but not the way it's trained. It's just the dentist. Dentist doesn't know shit. It's not a doctor. You know?
Yeah,
Hangover?
get your teeth clean.
You know Hangover?
Yeah.
Dr. Price.
Yeah.
What do you mean, Dr. Price? You're just a dentist.
Yeah.
Don't be fancy about it.
That
That's what he
movie
said.
rips on dentists so hard. Yeah.
Very hard.
What am I supposed to do with these root canals, Doc?
Same. So root canal essentially, is a pain treatment, an acute pain treatment. You know, tooth pain is insane. It's like a migraine.
Oh, it's the worst.
Why? Because it's in your brain. It's on that nerve, and the nerve is directly here. It's in the brainstem. So it's like the most hell migraine. Definitely, we need to get you out of pain. That is what a root canal was designed for initially. And this is the only time we need to do a root canal. That's it, medically speaking. However, a root canal is often used for prevention of pain too. So if you get a veneer or a crown, oftentimes dentists in some countries is actually mandatory, will perform the root canal so that you don't have pain in the future that might happen from drilling a tooth. So a root canal is a fine art. Don't get me wrong, all dental friends out there. I know you're having a good skill there. However, from biological point of view, you're leaving now. So you have that tooth, it's alive. So you have pain because you have a huge cavity and basically the oral bacteria jump in there. And then the immune system in your tooth, in the pulp, cause an inflammation, pain. Then we take out that vital, alive part of the tooth called the pulp. There's the nerve supply, the autonomic nervous system, the lymph supply. We just take it out and clean it and disinfect it and fill it. But basically what we leave in your body is now a dead shell of a tooth with no more immune system, no more blood supply, nothing is in there anymore. So for biting, it obviously works, not a problem at all. So can quote me on that. And root canal works for biting 20 years, 30 years, 40 years. However, it's a dead organ. And no medical department allows a dead body part in the body. Imagine a gangrenous toe or gangrenous finger, like a black toe. It's been cut off in a second because we know that the bacteria and the debris and the putrefaction spreads. However, in the mouth, it's totally fine to leave something dead sticking in there because for vanity reasons, we can put a cap on top or a veneer and it looks amazing. So on an x-ray, we oftentimes see hell below your vanity, or what we need to do, we do a 3-dimensional x-ray because oftentimes these chronic inflammation that can happen then from a dead body part in your body. So there's no more immune system, that root canal getting chronically infected over time. If you look at that tooth on a very tiny electron microscope, you see that per square millimeter, we have a lot of tubules, 30 to 70,000 actually. And bacteria just love it in there because now there's no more immune system to attack them. And our immune system from the outside will try to navigate and help with inflammation, causing cysts on the tip of the root or sidely from the tooth. However, that's a chronic thing and that usually doesn't hurt. So if your dentist asks you, there's root canal on the x-ray on the 2-dimensional one, and they usually will ask you, does it hurt? And you say no. Why? Because nothing chronically hurts. That's like the trick of the body. Chronic means the volume gets turned down, body becomes lazy, has no solution, so no more pain. So it's the wrong question. We have to see it on a 3-dimensional cone beam scan. And if you look at this one at a cone beam or in these cavitations, then you'll find it. And you see I would just estimate above 80% of all cases, there is a chronic inflammation on that tooth. Why? Because it's not natural to keep something dead in the body. It's just, it will putrefy. There's bacterial toxins, and it's just a cave for anaerobic bacteria, meaning chronic infection, meaning chronic inflammation. And in the epidemic of chronic health issues, we need to find all these silent inflammations because they are firing up the system on a low grade. That's the root canal thing, if it makes sense.
So what do we do? Pull it?
First of all, if you hear that, don't get scared and go pulling it. That would be non-strategic because it's a chronic thing. You have time. However, what we do is you send in, for example, Ryan, send me your panoramic 2-dimensional x-ray is enough. And I will see, okay, there's metal, there's root canals. We have to take care of this. What we do is plan your case completely. And yes, we do remove all root canals because they're always chronically infected and guests fly in to see us for this. However, we not just yank our teeth or pull them. We think ahead of the time. And what we do is we take out the tooth very, very gently. This is actually pain-free treatment because the tooth is just hanging in there. We wiggle it out. We don't yank it because the goal is to keep the complete anatomy, the socket. That's when you take out a tooth, they have that bone socket. And what we do then, we disinfect it with ozone. We use PRP from your veins. We clean it perfectly. But then, if it's perfectly clean, we place immediately a ceramic implant, not titanium, not metal, ceramic implant. Why? Because now is the time to heal for your body. And that ceramic implant in there is kind of like a tent pole stabilizing the whole jawbone anatomy. So usually if you don't do anything, the socket just collapses, meaning you lose bone, width and height, and therefore tissue, meaning you come back to a dentist 3 months later and he will tell you need a bone graft. 3 months later, after tooth extraction with an implant, we're already finished because that implant heals in that 3 months and it's usually osseointegrated, and then you can just place a tooth on top, a cap on top. So that's why our guests fly in for one health optimization week where we do it all, remove the metal safely, take out the chronic infected root canal teeth, place ceramic implants, take care of your jawbone cavitations. And then when you come back, we do the aesthetics, the vanity, the function, the biting. The vanity actually is just a side effect of perfect function. Form follows function. So it's a given that highly biological dentistry is also the highest skilled cosmetic dentistry. It has to be because only then it works, because I don't want to see again, right? And in that first health optimization week, we then have everything on site, from IVs, hyperbaric, hypoxia training, a red light bed, infrared sauna, everything you can imagine that a biohacking center would have. Why? Because we need to build an oasis of health so that when you come in, we can do this quite pain-free. You won't look like Rocky Balboa. You're just in a healing environment, and you're also prepared. Before you even come in, 4 to 6 weeks prior, you start the right nutrition. We focus on thinking the nutrients and building the right building blocks for strong teeth and bones. So it's a huge process, but it actually saves you to go to the dentist for the rest of your life. And it's quite charming. Imagine how many times you go to a dentist for just one root canal. And yeah, that's why most guests fly in from literally all over the world for more than a decade. And yeah, right now, finally working on the blueprint to bring this to all over the world, because it's needed. And yeah, makes sense now.
I love it. So if it's the one-stop shop,
yeah.
What about the age-old teeth cleaning? We still need. Is that still
the good old
an
teeth
outdated
cleaning
practice? Or is that still needed?
I think this is a smart investment. I brush my teeth once a day. I have a very solid real food diet or nutrition or lifestyle. So I don't really have to clean them too much, but still with drinking, I like coffee, I like teas, and they will just stain a little bit. And the biofilm is when like all the microbiome attaches a little bit to your teeth. You will never get that as good as a good hygienist. Of course, we do this more holistic biological, meaning we don't use fluoride. We don't use any chemicals in your mouth when we do a professional cleaning. It's more like, obviously, this is also upgraded. It's a new way of thinking. And I don't have any problem, for example, with if you want to have white teeth, why not? We can combine it all. But most of our guests, when they come back for this, those are more the local ones. And they will usually combine it with some sort of health optimization. They might run an IV at the same time, or go to a hyperbaric session afterwards, or have regenerative aesthetics, hydrofacial, everything in there, something PRP for the skin. We all work on longevity, and a part of it, I think, is looking good. It is important. I think a healthy body kind of looks good, right? It's the opposite to, let's say, the Hollywood aesthetics, where you like work with a lot of fillers and stretching. But why not use innate healing capacities, or just let's say reduce aging, that we don't age too fast, by using smart tools, or innate healing factors such as PRP or PRF. We even use that in the jawbone all the time. Also, what we try to do is obviously get all the patients or guests out of stress mode. So sometimes just setting up like 2 to 3 hours and do more for your body, just getting you out of the stress, or have to do it all at the same time. We sometimes purposefully schedule it after each other, like stacking it more than stacking it together, like in a obviously smart way, so that it's more about you. It's a little bit important. It's very important, I think, to de-stress everyone out there. I think it's one of the biggest health hacks to relax. And this is also how we created the complete center, the BGS, to get out of stress mode. So personally, I personally see maximum 2 guests per day, and very few. Like I said, it's more like, if you compare it to restaurants, what we do is more like you and your wife are there and there's 4 waiters taking care of you, versus fast food, which is normal conventional stuff, even conventional biological dentistry, which is not bad. I mean, we still probably need various levels, because some people don't need the full shebang. They might need literally just a crown, or take out an amalgam filling safely. Not all of them need the whole, let's say, platinum experience. However, if you look at all the X-rays of most of us in our age or older, definitely the boomers, still the millennials, they have a mouthful of toxic metals. They have a mouthful of root canals. They have a mouthful of titanium implants. Why? Because they were affluent and they could afford it in the first place. It's not something for people that have no money. It's usually the ones that could afford that in the first place. And my goal obviously is that we do not need a dentist for repair in the future. So my kids definitely don't need to see a dentist for repair. But that starts soon. It starts very young. That actually starts with teaching women before they're even getting pregnant how to support your body during pregnancy so you don't lose teeth. I have so many of my patients came in and told me they had this and this root canal. These 3 root canals are all their teeth, all their kids that they had. Like during every pregnancy, I lost a tooth. This is something I hear a lot. Like, because why is this happening? So teeth and your bones are kind of like a reservoir or a storage unit for minerals. So if you get tooth decay, it shows me it's not a fluoride deficiency. It shows me is a deficiency of certain nutrients. And if you're in pregnancy, obviously the priority is the baby in the womb, is not the mom. So if the mom is in a deficiency after pregnancy, she will be depleted. So that's why it's so important to front load pregnancy and then during too, so that first of all, the baby gets a lot, but also the mom survives healthy, because it's kind of like 3 marathons in one of these pregnancies. I know I have 4 kids, so it's insane. But you actually can do a lot if you know about it again. So that's also part of a future health expert. If it's a medical doctor or a dentist or a naturopathic doctor, it doesn't matter. We have to know about oral health, about nutrition, about whole body health. And yeah, but right now we still have to repair a lot from previous dental work.
I have 4 boys and 3 of them are in braces.
How, you have 4 boys?
Yeah.
Ryan's a great dental client.
The funny thing is that you didn't need the braces, but probably your wife. Ask your wife if she had braces.
She did.
She did.
So she gave him the bad teeth. I'd say, I gave him the brains. She gave him the bad teeth. I'm kidding.
So funny. Yeah. How old are you boys?
That's funny.
15, 13, 12, and 9.
And the 9-year-old has braces? No.
No, he's the only one that doesn't. 3 of the 4, the 12, 13, and 15.
I mean, my boys are 10, 8, 5, and then I have a little girl. She's only 2. So I hope they won't need braces.
Yeah.
But usually it took a couple of generations for us to degenerate and grow smaller, right? So it might take a couple of generations to get that back. So I'm not 100% sure if I can make it possible for my boys already to have no braces, but I can see already for the 3 older ones. So luckily my wife was able to breastfeed a long time, at least 18 months, even longer, which is initial orthodontics. So breastfeeding basically grows the lower jaw forward and teaches you nose breathing, and that nose breathing creates the bigger, wider palate. So they have kind of like a very good structure already, and we focus on eating good foods. Let's say at least an 80-20 approach, but there will still be some sugar and still be some processed foods. I don't want to be dogmatic about anything. However, I'm being cognizant if they're starting to nose breathe, if they're inflamed about any food, or also see a orthodontist to see, do they need a little bit of let's say, applying a little bit of, not force, but a little bit of stretch and movement. Yeah. Exactly. Expansion. That was the word I was blanking on. Expansion during their growth phase, so that they might not need any like fixed braces in the future or any aligners. And I'm quite sure it will happen. But maybe if it jumps a generation, then at least their kids will have it.
Yeah. Love it. Doc, as we close out here, give our listeners some practical tips for things that they can do for optimal, like oral and biological health that, that they could, maybe take with them.
So I think if you want to do something like straight away tomorrow, then ditch your conventional toothpaste and invest in something more natural. Conventional toothpaste, any aisle in every supermarket worldwide is copy paste the same. Fluoride, a lot of other chemicals, triclosan, sodium lauryl sulfate, carrageenan, you know the names, they're all the same. So you need to find something that is more natural, let's say coconut oil base, and has active ingredients. So it doesn't make, I checked like every little health store in America. Most of the health stores do have natural toothpaste, but they lack active ingredients. So with an active ingredient, I mean, it's not an essential oil. It's more like find something that has hydroxyapatite in it. Find maybe something like lactoferrin or probiotics, or sometimes even vitamins in it. There are a couple of good brands in America. I'm not so familiar with them, but you will find it. full disclosure, if I'm able to say, I have my own companies in Europe and America. So we launched a toothpaste in Germany called More Than a Toothpaste for Europe. It was unfortunately sold out within 2 weeks, so I have to bring another round. But we are right now building the same thing for America too. Why? Because the most asked question I ever got in my whole life is, what toothpaste do you recommend? So find something clean. And most of the time you have to look online, to be fair. Hydroxyapatite, probiotics, no chemicals, maybe coconut oil base. That would be great. Then invest in a copper tongue scraper. Just to start tongue scraping, it's a 10-second investment every morning. You scrape the back of your tongue, and over a couple of days, it will help against bad breath. It will help with detoxing your mouth. It helps with the oral microbiome. It's an Ayurvedic strategy. It's very simple. You just have to do it. And the third one I would do for just cleaning would be, don't do conventional mouthwashes. They're highly acidic. They designed to clean floor, so it makes no sense. Or a toilet. That's what you can do with it, but don't throw it in your mouth. So all the blue and green and brown stuff you can find in your local supermarket, just toss it. And instead, buy yourself some extra virgin coconut oil that you might even have at home for cooking. Do a teaspoon of this in your mouth every morning, 5 to 15 minutes. Again, it's a little bit of a time investment. It has to become a protocol, a routine. If you make that into a daily habit, within 30 to 60 days, you're using it, and then you will feel your mouth is becoming like balanced again. And number 4 is your nutrition needs to be on point. And if you eat mainly real food, something you can hunt, like or fish, meat, fish, eggs, and then ditch most processed foods, mainly gluten and sugar, obviously, like every dentist will tell you. Sugar, refined vegetable oils is all over the news. It's not good for your gum health. It's very much causing or a contributing factor to bleeding gums. And invest in something, in the nutrients that your teeth need to be strong. Like I've created a product it's called Tooth Shield in America. It's there in Europe called Bone and Teeth. It's basically like I said, like you said, it's basically a one-stop shop supplement. It contains every nutrient your teeth need to be hard as stone and not soft like they're right now. You need vitamin D3, vitamin K2, magnesium, zinc, boron, biotin, methylated B vitamins, very, very important, and manganese, molybdenum. It's all in one, and it's just like watering a plant. Yeah. Your tooth decay and your soft enamel is not a fluoride deficiency. It might be a deficiency in nutrients. So that's Supreme Oral Health Tooth Shield. If I'm not allowed to say that, you just cut it out.
Oh, no, please.
Yeah. So I'm very proud about that and happy, because one of my teaching is the bone healing protocol. So in Europe, the name is Bone and Teeth, but the same thing for America is Supreme Oral Health Tooth Shield, your invisible mouth guard, D3, K2, magnesium, zinc. And you will see sensitive teeth is usually a sign for softer enamel, and soft enamel means demineralized teeth. A lack of mineralization. So obviously water your plants, in this case, give your teeth the right nutrients, because naturally these little things are hard as granite, or is it granite in English? Hard as stone, hard as granite. But they become soft. That's because we all become soft. We are decaying processed foods. 90% incidence for tooth decay in the Western world. Lack of nutrients, not lack of chemicals. Just simple as that. And maybe the 5th one is find a certified real biodentist. You can find it on our directory that literally does the protocols we do. I cannot say just find a biological dentist. Really literally needs to be certified real biodentist. Invest your time in this. Go see one, get a 3-dimensional X-ray cone beam with them, and then work on your overall health optimization strategy from the mouth. It's an investment to basically not see the dentist anymore again for repair. And obviously healing overall.
We'll call that Dr. Dom's top 5 for going to your highest oral vibe.
Boom.
Nice one.
Boom.
Boom. I like it. I
love it, Doc. And one last clarification on the coconut oil. Yeah. Is that like swishing around in your mouth the same you would mouthwash? Like gargling with it?
But the thing is, for coconut oil, you should do it at least 5 minutes, 5 to 15. I personally just do it. I cook breakfast every morning.
You just around with it in your mouth, kind of.
Yeah, you just swish it around, you pull it around, and then you do it like this. But at least, like I said, 5 minutes. So I do it while I cook my breakfast. I have no extra time needed. I just think about
we spit it out, right?
And then you.
I've got a bottle of it on next to my sink. I just bought some off Amazon. It like Ayurvedic coconut oil pulling. And like you said, I haven't taken the time to do it.
Exactly. The main thing is usually consistency is key here. And but literally just the cooking oil, the extra virgin coconut oil will do the trick. I mean, your ones is probably even better with essential oils, taste better and is probably even enhanced. However, the thing is, do it. You need to do it. And the strategy is usually the commute. You do it under commute, or you do it while cooking your breakfast, because then you don't forget it and you make it a habit again. And then obviously spit it out in the bin, not the sink, because it will clog up the sink. Don't swallow it.
And I know the hydroxyapatite, is that how you pronounce it?
Hydroxyapatite. Yeah, that's
I know Amazon has tons of that. I've been using that now for about a year. Some brand off Amazon.
Exactly.
Free.
The thing is, you just won't find it in any health food store. I don't know why it is. Maybe
CVS and Walgreens has none of the healthy stuff. They might have one option of a natural.
Yeah, but the natural they usually have, and I checked Sprouts, I checked Whole Foods, I checked every little one, and they usually only have the ones with essential oils. That's not an active ingredient. It is probably for everyone out there who has the ideal nutrition, never touches processed foods, and is like an hermit. Yes, that works maybe. But for anyone who lives a normal life still, let's say at least as 80-20, you need to have some sort of nutrients to build up your teeth. And your enamel is hydroxyapatite. So why not just use it? And it comes with no side effects. And fluoride is a very strong toxin. And I mean, you see the media right now with RFK, and I think, was it Florida? No, it was Utah. Utah banned water fluoridation already. And Dr. Maya, my colleague from Boca Raton, Dr. Maya Georges, she is all the time in the news for speaking about fluoride for Florida. I think Florida has even banned it already, or is going to ban fluoride water fluoridation quite soon. Yeah, because we know it makes your teeth harder but more brittle. It's nothing. It has nothing to do in your mouth. It's just a strong disinfectant and very, very neurotoxic. Even there's studies showing that it makes the IQ of your kids a little bit lower. So why would you use something if there's a better, healthier alternative without any side effects? I mean, it's a no-brainer, right?
Yeah. There's a lot of things that's no-brainer. That's why we have this show, though, because we got to educate people, to make change. Change is hard to enact. I don't know why.
I can attest to that. That's the biggest fear of all of us. Is not of me. I love change, but the biggest fear of humans is the fear of change. That's why you always get attacked for new things, because it's misinformation. We have to change. We have to change the running system. No, just have fun doing it.
Yeah.
Learning new things like a little kid.
Exactly. Where can everybody keep up with you, everything you're doing, your practice, your products, etc.?
So Instagram is the easiest. It's Dr. Dom 1. So you would say Dome, D-O-M-E and a 1. Or just go to drdomofficial.com, DOMEofficial.com. And you find everything there. A huge library of information, because I'm sharing it all. And if you're a dentist that is open-minded and wants to be certified, just text DM us on Instagram or go to the Institute of Biological Dentistry. And this is where we start. It's not a course. It's the software update, and then it's the intro to the complete ecosystem to become a biodentistry global standard practice, basically.
Awesome. Chris, any final thoughts?
Hey, I thoroughly enjoyed this, and I'm going to make sure I start my coconut oil pulling tomorrow morning. Now that
I got my top 5 here. Yeah, I got my 5. Yeah, Dr. Dom's 5. We got them. Dr. Dom, we really appreciate your wisdom and everything you're adding to this space, the innovation and just the education and, just the whole approach you take in everything.
Thanks, guys, for having me. Appreciate it a lot that you talk about health and, bringing all the experts to, make it a global movement, because we're only strong in numbers, right? And we have to change something. That's right. We can do that together.
That's right. We appreciate all our listeners. We appreciate Dr. Dom. Hey, we don't know everything, but we're here to empower you. It's about knowing, knowledge, understanding where change is needed, and understanding doctors out there like Dr. Dom that are making a difference in how we approach healthy living. We'll see you next time on Vibe Science.
The content discussed on this show is provided for reference and educational purposes. The content is not an attempt to practice medicine or provide specific medical advice. Always consult your personal physician for medical advice and proper diagnosis.
Thanks for listening. This is Vibe Science. To learn more or watch full episodes, visit vibesciencepodcast.com. Here's to discovering your highest vibe